To the first webinar Wednesday of 2021. This webinar is brought to you by Can Do Multiple Sclerosis. Tonight, we're going to be focusing on exercise and diet updates for people with MS. My name is Louise Duncan, and I am your presenter this evening. A few housekeeping items before we start the webinar. If you have any questions for our question and answer portion at the end of the webinar, please use your question and chat box. There's a little diagram of it there for you to reference. Please submit any questions. If the box is closed, go ahead and click the plus to expand and submit those questions. If you have any technological issues during the webinar, please call the GoToWebinar attendee support line. That number is 877-582-7011. Again, that number is 877-582-7011. A friendly reminder that a copy of the PowerPoint, the library article, and a recording of the webinar tonight are available for download. You can find that PowerPoint and the library article in that same GoToWebinar control panel. Okay. I'd like to introduce our speakers this evening. First up is Lynn Stazzone. Lynn is a nurse practitioner. She's based in Boston, Massachusetts, at the Brigham Multiple Sclerosis Center. Next up is Alec Ng. He's an exercise physiologist. He's based in the Milwaukee area, and he's a professor at Marquette University. As I mentioned at the top, tonight we're focusing on diet and exercise updates. This evening's learning objectives are learn about the impact of the gut microbiome on MS and the role diet plays, recognize how exercise can improve function in MS, and use current recommendations to start forming personal goals for diet and exercise. To illustrate our learning objectives this evening, we have invented a fictional character named Holly. Holly, Lynn, can you tell us a little bit more about Holly and get us started?
Sure, Louise. So Holly, of course, what Louise said, she's a fictional character, but for our purposes of this talk, it will be very helpful because we will wrap up with her at the end of our talk. So Holly is 40 and lives with MS. During this pandemic, she's picked up some of the following behaviors. Smoking, she's been eating poorly, eating lots of processed foods, fats, and salts. She hasn't been exercising. Usually she goes to the pool, but that's been closed and she's been stuck inside. As a consequence, she's gained some weight, she has more fatigue, and has developed poor sleeping habits. So in other words, Holly, this cartoon right here shows a tightrope, where with MS, you're sort of a sense of feeling out of control with MS because you get the diagnosis, you don't know where it's going to go, and balancing lifestyles and all that, you can walk on top of the tightrope. But because her behaviors have changed, she's now fallen off the tightrope and is hanging on. Next slide, please. So just to sort of start off talking about the Food and Drug Administration, which is essentially responsible for protecting the public health and ensuring safety and efficacy of all their products. It's just a huge multi-million-dollar safety organization. And is because the food we eat, the medications and the vitamins we take, and the cosmetics we wear can affect our body's functioning in both a positive and a negative way. Next slide. So I know most of you know this, but MS is known or is caused by an immune attack in the central nervous system. It essentially involves T and B cells as well as macrophages. It also has a susceptibility or a genetic background, but we know it's just not the genetics of the disease. There is environmental factors that play a role. And more recently, there's been research regarding nutritional factors for the disease pathophysiology. This is an interesting concept because that is one thing that we can easily control, is what we consume, or dietary factors. And we can modify and customize diets for individual requirements. This, of course, would be in conjunction with conventional strategies. Not to say that doing diet would be the only way to treat MS. You want to really look at sort of the scientific or disease-modifying regimens and complement it with diet. Next slide. So we've probably all seen circles around MS and just to describe what it is or what it isn't, or how it all intertwines. But this is sort of looking at diet in MS and saying, it, depending on what you eat, can affect what happens in your gut or your microbiome, which in turn can affect how you metabolize certain bacteria or fungus or viruses. And then this can lead to certain comorbidities. So an example would be, if you eat a diet high in fat, your metabolism is going to be different than if you eat a plant-based diet, which in turn can cause something like atherosclerosis or cardiac problems, which in turn, if you eat more fat-based foods, your body shape is going to change. And it can circle around the other way. So if you're heavier, you can develop more comorbidities. Another example would be type 2 diabetes, which in turn slows your metabolism. So all of this circles one way or the other, but affects MS. Next slide. So the gut really is one of the most complex ecosystems that we have. There's about 100 trillion bacteria in our gut, and there's about 1,100 different species. And there's probably more bacteria in us than there are human cells in us. So there's like lots of bacteria there. There's also fungus and things like that, but our focus is going to be on bacteria. So its primary function is to digest food, right? That's what our gut does. But it also influences the body, how it functions in much more global level. So there is the CNS can directly interface with the gut through what's, if you can see on the cartoon, through the vagus nerve. And this is done by releasing acetylcholine, which can suppress the secretion of what's called pro-inflammatory cells. So you want a balance between less pro-inflammatory and more anti or non-inflammatory cells. So it can also change, and these type of pro-inflammatory cells are what are called tumor necrosis factor, or IL-6 and IL-8. And this is where we'll talk about a little later, the benefit of probiotics might mediate this sort of pro-inflammatory response. Then looking at the neuroendocrine pathway, stress can be related to this, what's called the hypothalamic pituitary adrenal gland axis response, which can elevate glucocorticoid levels and cause this sort of stress-related neuroinflammation in the gut. Then it can also, if you look at the bottom of the cartoon, have the environmental influences of what actually is going in the around in the microbiome itself. So what's happening in the microbiome can affect what's happening in the brain, and the brain can affect what happens in the gut. So it's a circular motion, and one affects the other. And I don't want this to be confused with leaky gut syndrome. So leaky gut syndrome is sort of this gray zone of, is it a diagnosable disease or not? Because everybody has leaky gut to one degree or another. And where it's more pronounced is in diseases like Crohn's or colitis, irritable bowel syndrome, or a celiac disease. That's a different local syndrome that happens as opposed to it sending information up to the brain. Okay, next slide, please. So at our center in Boston, there have there have been research going on in the microbiome in MS. So next slide, please. So one of the trials that happened about 4 years ago was there were 60 patients with MS, and they all had relapsing remitting disease, but they were non-active at the time, were compared to 43 controls. And what was collected was stool, peripheral blood, and breath samples. And each of those two groups, the MS patient group and the control group, were of similar demographics. So same age, same weight. They couldn't actually delineate diet at that point, which is very difficult to do. Next slide. And what they found was that there was more of a particular two bacteria in MS patients compared to people who didn't have MS. And one of them is Bacter and Akkermansia. And what we know in children who have obesity that there's a higher propensity of this Bacter. And we know from research that if you have obesity as a child, you have more of a propensity to develop MS in adult life. Next slide. So this particular bacteria, Methylbrevibacter, dominantly produces methane. So one way that you could measure this bacteria without doing it through stool is through a methane breath test. So what they did was they tested the breath of people with MS and controls, and it showed the same results, that there was a higher propensity for the higher incidence of Methylbrevibacter through this breath test. So it's an easier way of collecting this information than examining stool. Next slide. So just to summarize this is that I basically said it, that there is an increase in MS patients with Methylbrevibacter and Akkermansia. And we know that these two bacteria tend to be pro-inflammatory drivers. So that seemed to be what was increased. And there was a decrease of this Buchananrhinomonas, which we know is more healthy bacteria in the gut. Next slide. So this basically shows that with the microbiome, you want this, what's called microbial health versus dysbiosis. And dysbiosis just means that there's an imbalance. So all of us have in our gut what you would call healthy bacteria and non-healthy bacteria. And there's a balance, and the healthy bacteria keep the non-healthy bacteria at bay. They're like the soldiers that keep on marching around and keep those bad bacteria suppressed. But with the introduction of, let's say, antibiotics or certain diet, that can change and put people into more of a dysbiotic state. So one way to directly manipulate the microbiome is to, let's say, the elimination of trying not to use antibiotics. Also, one way to change the milieu of the gut is through fecal transplant, and I'll go into that later. And also, there has been evidence that it shows support with changing the bacteria by using either pre or probiotics or a combination of both. And then diets certainly can be changed, and we'll go into that later as far as less fatty foods, less salt, and looking at those things that can keep your the bad bacteria more regulated. New slide. So where can direct therapeutics change the microbiome? And antibiotics certainly target specific members of the microbiome. So they can be used to target the bad bacteria sometimes, and sometimes they create an overabundance of it. So it's like a mixed bag. The bacteriophages are viruses that can infect or kill bacteria without having a negative effect on the host. So that can be done. Probiotics are basically replacing or fighting off the bad bacteria. Multi-species community probiotics are a collection of organisms that replace missing function. Prebiotics can alter the composition of organisms in the gut. Symbiotics are a combination of probiotics and prebiotics and believed to have a synergistic effect, inhibiting the growth of the pathogenic bacteria, enhancing the growth of beneficial organisms. Nutritional therapy would be, how can you change your diet in order to have a beneficial effect on the microbial environment? And then community replacement would be something like a fecal transplant, which changes the whole milieu of the gut. New paragraph. So we did another trial at the Brigham using probiotics, which are known to induce what's called T regulatory cells, which are very beneficial in controlling MS. And the particular one that was used, next slide, is called VSL number 3. This is a mega probiotic packet. And it contains, next slide, these particular bacteria. And I want to make a disclaimer here that I don't want everyone to run out and try to find this probiotic, because this is a small trial with very few patients, and a lot more research needs to get done about what probiotic would be better or not. But there are some things that we know that lactobacillus, there have been some studies that show it can have a deleterious effect on MS, and some say that it's an important bacteria to have to decrease the effects of MS. Next slide. Okay, next slide, please. I think I said they needed to say. So there was, they could tell after they gave this high dose probiotic and they measured stool and blood that it did change the milieu of the gut by examining the feces. This association didn't last for very long, so it only lasted a couple months after stopping the particular probiotic. We know that, if you measure, unfortunately, right now we can only measure stool, but we know higher up in the gut, the milieu is going to be different than lower in the gut. So we can only go by what we can measure at this point. Next slide. So as far as the so let me talk about this briefly. The fecal, this is a fecal microbiota transplant, and basically what that is, if you could just go to the next slide, is the taking feces from what's called a healthy donor and transferring it into an individual to restore their balance. And where this was first examined was in people who have C. difficile infection. And oftentimes people get C. diff infection if they've been on chronic antibiotics. And once again, that bad bacteria takes over. And usually people have loose stooling, diarrhea, abdominal cramping, and they've tried everything. They may start a course of an antibiotic called vancomycin, which people have to stay on for a month or two. And if that doesn't work, they developed a program where they take fecal matter from a healthy donor into the person who has the C. diff. And that works quite successfully. I mean, 90% effective is pretty incredible. So they do this by taking the feces, either putting it in through a colonoscopy or an enema, and sometimes, but not as often, it's found in oral capsules, and it's put down someone's nose. So they're not, a person isn't swallowing it, they're putting it in through their nose into their gut. I think that'd be kind of gross if you had to swallow that pill. Next slide, please. So basically, in relation to everything I've just said, it's really important to maintain homeostasis in the gut. And there's a variety of innate immune cells that promote or suppress this T cell differentiation and activation in response to intestinal bacteria. And FMT, or fecal microbiota transplant, is just one way to return the gut to this more homeostatic state. Next slide. So when you look at nutritional therapies, and I'm not talking about a specific diet at this point, but it had to be shown that can diet or what we eat make a difference in what we're seeing. So this was looking at, once again, a small amount of people who ate either a plant-based diet or an animal-based diet. And it showed, if you can look at the scales, that depending on what food you ate, it varied in like the amount of fiber, how the bacteria responded. So you can tell by these scales that depending on what diet you're on, you're going to have different effects in the gut. It's just very hard to do long-term diet studies because it's very hard to control what each person in a particular group is going to eat or not eat. So everything can throw it off, such as if someone is just eating a plant-based diet, but they're drinking alcohol, or they're not drinking alcohol, or vice versa. So diet studies are very hard to do, but this just shows that people can certainly change the milieu of their gut by what they eat. Next slide. So here's another example. I know, once again, I apologize, it's a very busy slide. But if depending on what food you ate, it would change the bacteria in your gut. So let's say you ate more blue cheese and cheddar cheese, you would have more lactococcus in bacteria in your gut. Versus if you ate string cheese, you'd have more streptococcus bacteria in your gut. So it really shows that depending on what we eat, it can change the bacteria in our gut. Next slide. Do we have? Oh, great. Okay, thank you. So this is several different study that showed between Africa and Europe that your microbiome has different bacteria depending on what country you're raised in and what foods you're eating. And the slide on the left shows, well, first of all, it's believed that your microbiome is developed within the first 3 months of life. And this depends on, one, how you're born. Is it either through C-section or vaginally? And then if you're breastfed or not. And that really creates your baseline microbiome, which essentially stays the same throughout life, except if you try to change it by eating certain foods. You can do that locally, but you have to keep that habit going. And then, of course, it also changes depending on antibiotic intake. Let's say if an infant had to take antibiotics. So due to time limitations, and I know that other webinars have discussed individual diets. So individual diets will be briefly discussed with our case study at the end of the program. And I will turn it over to Alex.
Thank you, Lynn. Okay, for learning with Effective 2, I want to talk a little bit about how you can recognize how exercise can improve function in MS and try to highlight some of the recent updates to the exercise guidelines. Okay. All right, so first off, why is this an important topic? I know people are interested in exercise, people are interested in diet, but it's particularly important for someone with MS because according to the Surgeon General's report in 1996, people with disabilities, including any type of chronic disease, are much less likely to engage in regular, recommended amounts of moderate physical activity, yet have similar needs to promote health and prevent unnecessary disease. So this puts people with MS at particular risk for health and diseases that are related to a sedentary lifestyle or detraining. And I think it's important to recognize the history of how far we've come with respect to exercise and MS. Historically, it was thought that exercise was bad for persons with MS. Persons with MS were told not to exercise and to live a sedentary and stress-free life. Well, of course, just living is somewhat stressful, and not all stress is bad. We now know, thanks to the pioneering efforts of Jimmy Hugo, who is the founder of Can Do Multiple Sclerosis, we now know that exercise is not only safe for people with MS, but also effective, and of course that not all stress is bad. And Jimmy was skiing up till the very end. So what do we know about exercise in MS? With all due respect to Tolkien, I like to look at this as kind of as a triangle, where we can consider things that were, things that are, and some things that have not yet come to pass. I hope there's some other Tolkien fans who recognize that. So at the base of the pyramid are health risk and fitness, information, facts, research knowledge that we've known for some time and is really associated with anybody. And this includes the beneficial effects of exercise for cardiovascular disease, certain types of cancers, including colon and breast, obesity, type 2 diabetes, which Lynn has already mentioned, as well as all-cause mortality. And if we start talking specifically about these health risks, we cannot talk about exercise without talking about diet. Again, there's a connection with obesity and weight loss. I'll get into this a little bit more at the very end of my talk, type 2 diabetes. And even with colon cancers, cardiovascular disease, now we're not talking necessarily about calories, but we are talking about the composition of food. And exercise can also be an independent risk factor for these diseases. So we have two ways to work at it. We can look at exercise or diet. There are some things that are particularly important for persons with MS. And we know now that exercise is important to maintain gait or improve gait. It's very important to maintain bone density. And this could be true particularly for someone who is, for women who are menopausal, but older men as well. But even young men and women have decreased bone density or tend to have decreased bone density with MS. So exercise can certainly help with that. There's enough evidence now, I think, to suggest that exercise can definitely help improve symptoms of both fatigue and can also improve mood as well as depression. Something like 5 minutes of exercise is enough to decrease anxiety. And finally, some things that we're just starting to learn about now, or where there's more research being done, are the effects of what I call myokines. Other people call them myokines too. And just like there are chemicals released from the gut that can come up and affect the brain, there are substances released from the muscle. One of these is brain-derived neurotropic factor, which is thought to travel, which may travel up to the brain and help improve memory and cognition. And interestingly enough, IL-6, which Lynn mentioned previously as a bad inflammatory substance, when produced by the muscle, as opposed to immune cells, they can actually act as an anti-inflammatory. And substances produced by exercise can also cause the brain to release BDNF. So with this in mind, what are the exercise recommendations? Well, the new recommendations are actually, okay, hold on to your seats. greater than or equal to 150 minutes of moderate exercise per week and or 150 minutes per week of lifestyle physical activity. But you can mix and match them. So this is greater than what was currently known, but they are the same recommendations as for the public in general. And as a result of that, if these recommendations are followed, or if you attempt to meet them, you can expect the same benefits as the general population. And these came about from a task force that was actually sponsored by the National MS Society. It was an international task force where people got together, looked at the existing guidelines, and recognized that, hey, people with MS, 150 minutes, this is what the research is based on, and this is what we should be recommending. I'm going to talk a little bit about this lifestyle physical activity first, a little later, because I can hear the internet starting to explode with people's eyes and brains going, what, 150 minutes? But we'll talk about some strategies on that later. Okay, so that's what's new, at least for people with MS. All exercise programs share similar components. One of these components is so-called cardiac or cardio or aerobic exercise or cardiopulmonary endurance exercise. The other major category is strength or endurance exercise. We now recognize that balance and coordination is very important. This would include yoga, tai chi. I think the official term is neuromotor. And then, of course, flexibility is important to maintain, well, flexibility to perform activities of daily living. So let's take a look at this. First off, exercise is something that is structured and purposefully performed. And we talk about an exercise prescription, and the prescription contains several features, and it's known as the FIT principle. One of the features is frequency, or how often should one exercise, let's say per week. The other is the intensity, and this is important, and this is how hard should you exercise. I think we have kind of an intuitive feeling of what mild would be. Maybe you're walking, strolling, or otherwise just kind of moving but not breathing very hard. Moderate would be where you're starting to breathe a little harder, maybe just breaking into a sweat. And hard would be where you're going all out, your heart is beating, maybe maximally. Time and duration is how long the exercise should be taking place. And type of specificity or mode kind of gets back to that resistance or cardiac or flexibility categories. And that is what type of exercise is the most important for your cardio or resistance. So for example, in my next slide, I'll talk, in my second to next slide, I'll talk about aerobic exercise and how we can meet these goals using either cycling, or we can do it during hand cranking or swimming. It's important that these goals are not one size fit all. They have to be individualized. It depends on what your own goals are, whether it be for health, to improve quality of life, whether you just want to hang out with your friends, chase around a grandkid or a puppy. You may be actually training for an event. There are people with MS that train for full-on triathlons and marathons, or maybe you're trying to take part in a charity event like a Ski for MS, an MS 150, or even an MS triathlon. There are risks, and everybody has different risks. Everyone has different circumstances. So you have to look at the FIT principles with respect to falling, whether you suffer from fatigue a lot, whether you feel any pain. And it also depends a lot on your starting level. So a couch potato would not be starting an exercise program at the same level as someone who is already, let's say, exercising for any competitive. And this also reflects your actual ability or disability level based on how you're affected with the MS. So if we talk about the aerobic guidelines or cardio, and this is a sample, okay? If you're really clever, you may have thought back about my recommendations where I said 150 minutes. And it really means that you can kind of get it however you want. So this is a sample. It's kind of a traditional sample but it will give you an idea of what a fit principle might look like for cardiac or aerobic exercise. So typically we might say, well, if I want to do this formally, I can try and do it 2 to 3 times a week. I can start, depending on what your starting level, start from a mild exercise, work up to moderate, and maybe your RPE will be 11 to 13 or 2 to 6. I'll talk about RPE, but this is just a way to indicate your exercise intensity, and it should be moderate. So your heart rate should be, it should be getting up there, maybe breaking into a sweat. It shouldn't be easy, but it shouldn't be hard either. Maybe look at 10 to 30 minutes. What are some of the modes or types you can do? Walk, run, cycle. You can pole walk, you can swim if you're fairly mildly affected with your MS. If you're moderately affected, well, you can try to do the same, possibly adapt it. Maybe look at freewheel cycling, pole walking, recumbent cycling, hand cycling, seated aerobics, aquatic aerobics. If necessary, you may need the guidance of an exercise professional, either an exercise physiologist, a trained personal trainer, or a physical therapist. If you're more severely affected, and these recommendations are based on expert opinion now as opposed to research, but I think this is important to take into consideration. You can exercise using your walker or wheelchair. There are breathing exercises you can do. I always like to suggest singing, hand cranking, breathing exercises again. And again, it may be important to take on the guidance of an exercise professional in order to adjust your exercise based on the fit principle. Okay, I promised you I'd talk about RPE. And so this is just a scale based from 0 to 10, where RPE stands for radians of perceived exertion. So to get into the moderate category, I would say you'd be looking at from 2 to 6, which is actually kind of light to hard. But if you're working in this area, this is a good area to be working in. So for a 10-point scale, 0 is nothing, 10 is maximal. You'll also see a 20-point scale. And using this scale, you'll probably be looking at 11 to 13, where 6 is rest or nothing at all, and 20 is maximal exertion. So 11 to 13 would be somewhere in between light and somewhat hard, something like that. There are some misconceptions, and I want to just briefly talk about these. There's kind of the traditional school of no pain, no gain, and that is, does the exercise have to be vigorous? The recommendations are actually for moderate exercise. However, it can be vigorous. Vigorous is okay and can be beneficial. And I know a lot of us, or I even used to discourage people from working too hard, but we now know that HIIT or high intensity interval training can be very effective for persons who work with MS. So this is high intensity intervals. So a short period of time, higher intensity. You don't want to overdo it though. So, we can talk more about this later. Do light activities that count? It may not be moderate. Well, for exercise, no, it should be moderate. And this would include though brisk walking, gardening, flat water kayaking. However, if we're if we're interested in health and wellness, then actually, yes, light activities count quite a bit for health and for physical activity guidelines. And then finally, must it be continuous? And no, it's the cumulative time that's most important. Okay, if we move on to resistance exercises, again, these are just samples. Frequency might be 2 times a week, or you could do it at the same time you do your cardio. We could do 2 sets of 8 to 15 times of lifting. Start slow to work up. You can have 1 session or multiple smaller sessions. What about the mode? I think this is the most important here. We could talk about different types of protocols all day. One could use free weights, machines, elastic bands. Body resistance is really good, such as planks, push-ups. You can lift soup cans. You can lift a milk carton. So you can be creative. And again, it is possible you may need to have some assistance from rehab or an exercise professional to get started with this. Breathing exercises are good. Just standing can be a good thing. And electrically stimulated exercise, if you're not able to fully activate your muscles, electrically stimulated exercise can also be helpful. Neuromotor, we don't know as much about this from a research sense, but this would be useful for balance, coordination, gait, and flexibility. Anywhere from 3 to 6 times per week, I'd say 20 to 60 minutes per session. What are some of the types here? Yoga, Tai Chi, Pilates. I would include dance and even hippotherapy. As needed, seek help from an exercise or rehab professional. Kids, do not do this. Boxing is another good thing that you could do. This has been used very effectively for people with Parkinson's disease, actually. It's really hard. I can't do it. Flexibility, so this would be stretching, and so frequency, it could be daily. You want to have 2 or 3 stretches. We like to recommend static stretches as opposed to those dynamic stretches. Hold each repetition 20 to 60 seconds. It can be done individually, with a partner, with equipment. Yoga often incorporates stretching. So, it could be that you combine your flexibility with your neuromotor exercises. If you meet these guidelines, and I'm going to throw in, if you attempt to meet these guidelines, you can improve fitness, reduce fatigue, improve mobility, as well as enhance quality of life. And this is all research-based. Okay, for those of you who were rolling your eyes when I said 150 minutes a week, let it be known that both the ACSM, American College of Sports Medicine, and the U.S. Department of Health and Human Services recognize that for all individuals, some activity is better than none. So if you're unable or unwilling to meet the exercise targets outlined, you can still benefit from engaging in amounts of exercise less than recommended. And physical activity counts. So you can mix and match your physical activity with exercise. 75 minutes of exercise, 75 minutes of lifestyle physical activity. I've mentioned some of these before, but chasing a puppy, strolling, cycling, using a Wii Fit or some type of a video game can count as mild to moderate lifestyle physical activity. If you're in a wheelchair, you can use a manual wheelchair for propulsion. You can swim. There's aquatics. There's all sorts of adaptive sports that are out there nowadays. You can look at seated yoga or seated dance. So the object here is to be as active as possible. So try to increase lifestyle physical activity to equal than or greater than 50 minutes. And again, it can be mixed and matched with exercise. If you're starting an exercise program, and those of you who are out there that are already exercising, you would be the best judge of all this, or you would be the expert, I should say. But there are often barriers to exercise. I don't have time to go into all of these. I'll just briefly talk about some of them. Maybe we can get into the question and answer. I know I'm way over time. But in fact, lack of time is the primary barrier, was often a barrier. Access to equipment, not having the knowledge of where to start, transportation, fatigue is always a big one. What are some ways to help? Barrier busters. Well, don't be scared or to use an assistive device or mobility aids. There's a 2-hour rule where you should feel as good 2 hours after the exercise as you did before you started. If you didn't, then maybe you should cut back a little bit. It's okay to miss a day or two. It's great to get some friends to provide accountability and to make the exercise more fun. Everyone has fatigue. There are good and bad days, and you're the best one to know about that and how to schedule. There are also various cooling strategies that can be used to help with heat-sensitive fatigue. So it's just important to note that physical activity and exercise are important. This is the first step to starting or maintaining an exercise program. Recognition of this. Also recognize that physical activity and exercise are achievable. Everything else is just relative. The bottom line is if it works, then go for it. Try something new. I'm a big fan of recreational physical activity because by its very nature, recreation means it's fun and it's something that I would then seek out. Try something new. Indoor climbing, skiing, biking, canoeing, dancing, and it can be adaptive as necessary. And okay. All right, I think that ends the so-called didactic portion of my talk. I do want to transition, before we get back to Holly, I just do want to mention that it's really hard to talk about exercise without talking about diet, and it's difficult talking about diet without talking about exercise with respect to health and wellness. Exercise is a form of metabolism. Metabolism is just the sum of all the energetic processes of the cells in our body. And in order for our cells to work, in order for us to exercise, we need energy. And this energy comes in the form of foodstuffs. You'll note that my illustration here, I used to use a hamburger and fries, but I knew Lynn was talking first, so I decided to use a plant-based illustration. Ideally, the energy in our intake should equal the energy out. And if we're in balance, then this would optimize our health and wellness. However, it's not just calories. It's not just calories, energy in and out. It's also the composition, as Lynn alluded to, as to what's the proportion of carbohydrates, or what proportion of fats, or what type of fats is it that we're eating. And with this in mind then, let's go on to our final learning objective, and that is to use our recommendations to start forming personal goals for diet and exercise. I'd like to try something different, or we would like to try something different. There's a whole lot of experience out there in our audience. So we've talked about Holly. This is what happened to Holly during the time of COVID. She took up smoking or started smoking again. She's eating poorly. She's kind of adapted a sedentary lifestyle, started gaining weight, kind of starting to get a little bit depressed because of this. She's fatigued, and this is also leading to poor sleeping patterns. So I want to pose it to you in the audience. What would you suggest that Holly do? You're the experts on this. So just go ahead and type in what your suggestions are in the questions, and either Holly and I will look at it and we'll pick them up and comment on them, or Lynn can state them to us. And while you're typing something, I guess we can kind of start it off. So Lynn, what do you think? How those things should be?
So one of the comments was to cut out processed foods. And definitely stop smoking. But processed foods have a lot of fat content. Now, Alex had mentioned there are some good fat foods like salmon fatty. There's some foods that are good fats like canola oil, flax seeds themselves. Those are good fats, or walnuts. Some nuts are good, but there are bad fats too. So cutting out those processed foods, which also more than likely have a lot of salt in them, which is not good either. So I think the comment that this audience member said is excellent idea for Holly to get back up on that tightrope is to cut out those processed foods.
I saw another comment in here that was to try and get a friend to help, and I think that's a great idea. I suspect Holly, assuming her social network is good, she may have a friend that will be willing to exercise or do something with her. This could even be via Zoom.
Right. I think
having a friend makes it more fun too.
Right. I think I was going to say to you, Alex, I don't know if you've noticed with people that you've talked with that you tend to exercise more if you do it with friends because you feel more committed, or if you don't go, you feel guilty. And not that I want people to feel guilty, but I think doing it with the friends, and even over Zoom, I see a patient I just saw this week who she goes to an exercise Zoom class with friends. They're not in the same place, but they're all on the Zoom together. So that's gets her motivated.
Well, I know for me personally, I do not have MS, but I feel that accountability when I say, okay, well, we're going to do this every week, and and then you can talk about it afterwards. I did see something. Now, I don't know if this is the way it's supposed to be. My questions are coming kind of fast and furious. I don't have a panel to see all of them, but one of them I saw was to go outside and walk, and that's I'm a huge fan of being outside. For someone with MS, being outside in the summertime. Now, granted, we have to be aware of skin cancers and things like that, but it does help promote vitamin D, and that can be a very important factor. Plus, if you're outside and if you're walking or strolling, that can also add to your physical activity counts.
So I think the subject of vitamin D, I think that's a really important one to get adequate amounts of it, because we know that studies have shown if you do have an adequate level of vitamin D circulating, there's less chances of progression of disease and less chances of relapses or new MRI lesions. So getting vitamin D naturally is wonderful. And my push is to get your levels checked at least yearly by your healthcare provider to see where you stand. Now, in the Northeast, is probably different than in Colorado or in the sunnier states. So we have a high propensity of people with low vitamin D levels. So it might not be as important if you're in a sunnier state.
Definitely. And in fact, here in Wisconsin, I don't think we even get natural vitamin D from like November to April or something, just because we're so far north.
Right.
I'm seeing a lot of answers such that eat healthier, do this or do that, but some of these results require some behavioral change, right, Lynn? Because after all, the presumption here is that Holly's doing worse than she was before. So presumably, if she was eating healthy, now she's not. So what can we do? What do you think we should do to get back to a proper diet, assuming she was on one originally, from a diet standpoint?
I mean, I think to set small goals is really important, as opposed to I'm going to eat healthy and I'm going to exercise the 150 minutes a week. Like, I think you have to work up to that, because you don't want to all of a sudden fail and then you get disappointed and you don't do anything. So I think it's important to start off by saying I'm not going to buy McDonald's anymore, or set small goals to work towards a healthy goal, because those goals are more than likely to stick around then if you sort of build up to them, as opposed to just whamming right into it.
In fact, here's one. Yes, tiny steps, not only behavioral steps, but physically steps included when shopping for healthy foods.
Right. So I think those are all good suggestions to get Holly back up on that tightrope.
I think she's in good shape with this audience.
Yeah, I think so too. I think those are really great suggestions, and I think they kind of play into our question and answer portion. I'm seeing some similar themes. As a reminder for everyone, before we dive into those questions, we will ask you to complete a survey that's going to pop up at the end of this webinar. So please make sure to fill that out at the very end. A lot of the questions we're getting, Lynn, have to do with specific diets. I mean, there's mention of keto, of Mediterranean, vegetarian, all these different diet choices or styles. Obviously, it's hard to give specific feedback without knowing all the specifics of our participants, but what is some general guidance you would give to someone who is beginning researching new diets?
So I would say the Mediterranean diet is probably a very healthy and easier diet to follow. So it's very lower protein and more plant-based, vegetables, fruits, less carbohydrates of the heavier carbohydrates, because an apple is a carbohydrate, honestly. But so I think if you stick to these, which the Mediterranean diet is more plant-based, that is a more healthier start. Unfortunately, it's so, like I said earlier, it's so hard to do research on diets. So one particular diet isn't necessarily the right diet, such as the paleo or Terry Wall's diet. So I think it's just finding a diet that makes sense, and then doing things in moderation, such as alcohol or caffeine consumption. I think there have been studies that show some alcohol is good for you, but you don't want to drink too much of it. So I think anything in moderation is probably the best rule to follow.
Great. That's awesome feedback. Alex, we're getting a lot of questions regarding stamina and fatigue. So if someone is coming off of an injury and having large amounts of fatigue, or maybe running into stamina problems as they're slowly easing into exercise, what advice would you give them?
It's almost the same advice as what Lynn mentioned earlier, and that is you have to kind of start small and pay attention to yourself. I've given talks where I actually have a slide and it says, pay attention to yourself, dummy. And if I go back to that 2-hour rule, and this is just a rule of thumb, I don't know if you'll see it in any books, but you want to feel pretty similar to before you started exercise 2 hours after you've done your exercise. If not, then you've overdone it, which means that you don't give up, but you just cut back the next time you go out. So you may want to start a log to help you keep track of things. So we could either cut back on the duration, so a shorter period of time, cut back on the intensity. So instead of hard, maybe go to moderate, or frequency. And that is, don't go out so many times per week. So that's it, kind of the textbook answer. Now, one thing is, if the exercise is correct for you, you may find that your MS-related fatigue will start to improve, and not immediately necessarily, and then your endurance, your actual muscle endurance. So now we're talking about a different type of fatigue, will also start to improve. One of the questions that I think came up was that, can people with MS actually improve strength? And the answer is yes. To the degree that muscle is not directly affected by your MS, and it is rather secondary to disuse or sedentary lifestyle, then yes, exercise will improve strength. And even if you have some problems activating the muscle, electrically stimulated exercise may also help to improve strength. That was a little bit of a sidebar, but.
Thank you for those answers. Appreciate it. We are close to the top of the hour, so I'm going to wrap up with some business keeping. I wanted to make everyone know about our January programs. We're keeping with the theme of diet and exercise through the month of January. Please go to candoms.org for more information and get signed up for these programs. We're a little limited on time for the question and answer, so the coaching sessions in particular give a lot of opportunity to get those questions answered. Please get in touch with us. These are our social media handles. And again, you can contact us or check out the programs at candoms.org. A shout out to the National Multiple Sclerosis Society and the Multiple Sclerosis Society of Canada. You can check out their website at nationalmssociety.com for additional resources. And if you have any additional questions, that's a great resource to check out. And I want to remind everyone of our next webinar Wednesday. It's really fun. We're liking the alliteration if you couldn't pick up on that by now. So the next webinar Wednesday will be a month from today, Wednesday, February 3rd at 8 p.m. And we're going to be covering the benefits of social activity and connection, super relevant during this COVID times. With that, We appreciate your attendance and participation in tonight's event.